Now, the Zimbabwe Human Rights Commission is working with South Africa's public protector advocate Koleka Gcaleka to deal with complaints that Zimbabwean citizens are being turned away from public hospitals in the country. This comes after several reports showed that some hospitals are refusing to treat not only Zimbabweans, but indeed foreign nationals at large. The Zimbabwean government has also said it will not pay for its citizens to get medical help in South Africa. The Commission's chairperson, Jessie Majome, emphasized the need for Zimbabwe to improve its healthcare system.
Foreign nationals are still being blocked from accessing public healthcare facilities in parts of the province. Activist groups insist that scores of immigrants have overburdened the system at the expense of citizens. Officials are criticizing this, expressing concern that the action could deepen social divides and compromise efforts to control the spread of diseases. Newsroom Africa's Veronica Machwadi is live for us from Crown Gardens Clinic here in Johannesburg. Veronica, we can see the situation seems to be escalating since last we spoke. Police are now there. What's the latest?
Yep, that's right, Iman. As we were, of course, speaking to some of the community members here, police have arrived and they have told the individuals here that have been essentially manning this gate, asking for ID documents and turning those who cannot provide any identification as being South African away. And they essentially are now pushing them away, telling them that they cannot do that, and that what mandate have they been given by which department or which authority to essentially not allow people to get access to healthcare services. Police have been here in their numbers, and what we do understand is that some of the residents that are part of this campaign to not allow foreign nationals to get access to healthcare facilities are essentially really blaming the police. They are having a standoff with them, saying that they are also not following their constitutional mandate to put South African first and to protect them. They are saying that when there are crimes happening in their communities, when they are called to certain communities, they do not arrive, but they are here. And I can tell you, ma'am, that there are about a dozen of them at least to stop people from coming into a clinic. And they're saying that, you know, this speaks volumes essentially about, you know, the efforts and the work of the police officers. I'm going to speak now to Petunia, who is amongst the community members who have been part of blocking those getting access. And Iman, if you can just see the visuals here, you'd remember these were the family members that we spoke to earlier who were denied access, and they are now going inside. Petunia, just talk to us a little bit. You were speaking to the police officer. I can see that there was a lot of frustration. There was a confrontation just moments ago.
Yes, there was. A confrontation. I'm so angry, I can't even talk. I can't even talk. Yeah, mandate, and didn't they take their oath to serve and protect the South Africans? So, like, they do not have answers for me. I even asked them about their constitution. They do not even have answers for me.
And what exactly have police told you now? I can see that there was a point where you were trying to stop another individual from coming in, and the police came to you. What did they say to you exactly?
They say that I have no mandate to do that. So I asked them if they were here, they just came here, they were supposed to come with Home Affairs. Immigration officers were supposed to be here with them. So their only job here is to open for foreigners to come and take whatever they want to take.
And there is a moment, as you said, you are quite emotional and you are quite angry. There are still questions as to why you guys, some of you as community members, continue to do this, despite the fact that they say that healthcare should be, you know, available to those that are within the country. Speaking, of course, to what the police have also said to you here this morning, saying on what mandate do you have to, of course, block some of these individuals from getting healthcare?
We stand a constitution to say that illegal immigrants cannot be served anything in our country because of they are illegal. We are talking about illegal immigrants here. While they are here, that means we are illegal. As South Africans, we are illegal in our country. They are talking about arresting us in our country while they are opening up the gates for illegal illegal foreigners.
When we were speaking earlier, when some of the people were trying to get in, you mentioned to them that you saw that there were women and children who were also trying to get healthcare services. You know, Does it not worry you in regards to the fact of some of the people that you turn away are in desperate need for these services?
Now we are being pushed for feelings. As South Africans, we cannot work feelings. We are putting feelings aside and putting our constitution first and putting South African first.
Are you not concerned, though, that should people not get the health care that they need, that we could see something, a far bigger impact in terms of health crisis, people, perhaps maybe even a fatality in the worst case scenario, and that they will pinpoint to you and your community members and the groups that have decided to go on to this campaign?
All we are saying, we are not refusing people health care. They should go to private hospitals. Why can't they go to private hospitals? Why can't they get their things straight, their papers straight? For instance, we have a person here who's saying that he's been holding asylum for 18 years. While you are here in South Africa, asylum for 18 years. Asylum is being, if I'm not mistaken, asylum is being renewed after 3 months. So every after 3 months, for 18 years you've been doing that. When are the right papers going to come?
Right, thank you so much for your time, Petunia. They're just, Iman, just some of the residents there that have expressed their dissatisfaction with the police's presence here. What we also know in regards to their presence is that we understand just yesterday at this very clinic, which has become quite the hotspot in regards to this campaign to block, several individuals and foreign nationals from getting help, is that we understand it was just yesterday where I believe it was another individual who got into a physical altercation with the individuals here as they tried to block them, where police in fact had to come to the scene. And so you can see that this is definitely one of those healthcare facilities that is definitely in the radar for the police in terms of just some of the altercations that have been taking place. But we know that for now they have opened the gates. They have told the individuals here that they are not allowed to do that. They do not have a mandate to block people from coming in. And so we're just going to stay on the scene as well, Iman, just to get a sense of what happens next.